Hello friends, this is Professor Dr. Sharadare. Right now I'm in Thailand during an international conference. So right now I want to introduce one of my very good friend Dr. Chen from Malaysia. I could not say from Malaysia because he is an international doctor who is working in more than 40 to 50 countries with their
80 countries.
80 countries, sorry my mistake, with all the modern facility. One of the most promising thing which I want to encourage with you, he is a person who can treat the untreatable. Mention my word, untreatable, because India has, the very high disease of diabetes, where all the organs are into, a stake. So the very good point, a very good formulation, a very good news to all of you. He can treat any patient of any disease where the life is being threatening. So I just want few words from Dr. Chen. So Dr. Chen, please tell me how we can deal with diabetic patients in India, especially where you have done such a wonderful job. Please, your views.
I'm an author of 50 over medical and scientific books, including contributing to the earliest stem cell book for medical doctors. And also with 100 over publication, I've given talks for 1,000 over conventions around the world for the last 40 years, across 80 countries, traveling around the world every month on a one-way ticket, and I only spend 7 days a month in Malaysia. I've been doing that for almost 40 years. Spent over years of my life trained by the Soviets in stem cell research, and also with the German and the Swiss in the 80s. So I believe there's a lot I can contribute. I always say that the body can heal by itself to a certain extent. We should be treating the root of the symptoms and not just the symptoms. So in the case of diabetes, my end game will be, my message across to be, it's a pancreatic problem. There are 13 cells and stem cells in the pancreas. If you were to give the islet cells to treat the diabetic patient, you will see wonderful results. That means the alpha, beta, delta, and the right pancreas. Give the islet cells. If someone say, I will give you the stem cell to treat diabetes, we also have to understand you have 400 over different types of stem cells and cells. The right type of cells determines a lot, because we need precision in medicine. All the 400 over different types of stem cells in your body are of different molecules, different amino acids, and different proteins. So if I have to treat diabetic patient, what is the problem? The end game of all diabetic patients is also a kidney transplant. Okay, a lot of diabetic patients have also the liver problem, and a number of them have heart problem. So I have to say, if you treat diabetes, give the islet cells, give the liver, give the stomach, give the intestinal mucosa, give the kidney, give the heart. And again, they may be having erectile dysfunction because for their age, because of a vessel and circulation problem, they may be having an eye problem. So you also have to give the stem cells of the retina. You also have to give the stem cells of the brain. You also have to talk about his hormones. Then you have to give the pituitary and the hypothalamus and the adrenals and the liver, of course, to do the modulation. And what about his gonads, his testes? So you have to do all this. At the end of the day, treating a diabetic patient means you have to look at the pathological test of the patient, look into the pathological test, which organ has been affected, target every organ. So if someone say, I give you one type of stem cells and you will cure all the other organs and turn into all the organs, if he can do that, he will win the Nobel Prize. No one has done that until today. The right way to treat will be go into targeted, give the precursor of progenitor stem cells, target every organ. You give the wrong organ, you give a heart for an eye, it will not work. Neither for a heart or a liver. A heart should be given the cardiomyocyte. A liver should be given the hepatocyte. So again, with the liver, there are 75 types of stem cells found in the liver. What do you need for liver regeneration? Liver for liver. The hepatocyte will be the best part of the liver, because we don't need the other 74 types of stem cells found in the liver, because they're not going to do liver regeneration. The liver itself is a dustbin, so it will collect all the cells. So what we want is very precise. I use the word precision in regenerative medicine. Stem cells is under the topic of regenerative medicine. That means you can regenerate every organs. As long as they are living tissue in any organs, you can do the regenerations. This is our way of treating even end-stage kidney failure of stage 4 and 5. As long as there's still some living tissues, you need the renal cells to do the regenerations of the kidney. You can't do other cells, it will not do the work. You may need some epithelial cells from the mesenchyme, but the main thing is the renal cells. So this is the way to treat. Again, when we talk about Parkinson, you need the substantia nigra. Without the substantia nigra, there's no dopamine. So don't talk about an A which can turn into A to Z. It must be a A1 for A1, B6 for B6, and Z10 for Z10. That is the way to treat. So that is my experience of being in this field for 41 years. I work with the Chinese, I work with the military or hospital of Chinese, I work with the Japanese, I've been across the world learning from everyone, I work with Americans, and I spent 30 years of my life in Switzerland and Germany in the field of stem cell research. Thank you so much.